Hello, and welcome to Module 1. My name is Lexi, and I'm one of the Provider Relations Representatives at Delta Dental of South Dakota. In this module, you will learn what the PreViser Risk Assessment Tool is and how it applies to Delta Dental of South Dakota patients. I'm here to tell you about our new and exciting benefit program. We launched our Health Through Oral Wellness program on January 1st of 2020, and I'm so excited to tell you about the details of the program. Throughout the duration of this presentation, we will cover the following objectives: to understand what PreViser is, to know what a risk assessment is and why it is beneficial, to understand the connection from oral health to overall health. We will identify who can have a risk assessment. We will know how to complete the risk assessment and explain the report, and identify how to implement into your daily practice. As I mentioned before, our program is called Health Through Oral Wellness. We use a risk assessment tool from PreViser to unlock benefits based on a patient's risk and severity scores. PreViser is a patented, evidence-based tool and is free to all Delta Dental of South Dakota providers. What is PreViser based on? Risk assessments are about predicting the future. This includes observable conditions, but also accounts for other factors to predict whether a patient is likely to develop the disease in the future. The risk score is about determining those who do not have the disease today but are likely to get it in the future. This way, we can intervene and prevent the disease from ever occurring. The severity score looks at a patient who already has the disease and rates the severity of the existing condition. It is not diagnostic. It is still the dentist's expertise that diagnoses and treats the existing disease. For example, let's look at a patient who has a higher risk of getting the flu. We would be looking for a patient who has a chronic lung condition, a weakened immune system, has severe anemia, the patient is younger than 12 months or older than 65 years old, is a resident of a long-term care facility, etc. However, if we were looking for a patient's symptoms or severity level of the flu, we would be looking for the patient who has a fever, aching muscles, chills, sweats, and a headache. Is it effective in influencing patient behavior? Here's a hot-off-the-press study to prove yes. In April of 2019, the Journal of Periodontology from King's College of London utilized the PreViser risk assessment tool on 97 patients. They were trying to determine if it influenced behavior to improve oral health. In just 3 months, not only was dental plaque reduced significantly for patients with the risk assessment, but not in the treatment as usual group. There was also more pronounced reduction of gum inflammation, and frequency of interdental cleaning improved only for the patients with the risk assessment. Here's another example that shows how the risk assessment changes behavior to improve oral health, especially for those who need it most. We know that it can influence behavior and increase dental visits and engage patients to improve their oral health. As you can see, cleanings per assessed member shifted from approximately 1.5 cleanings per year prior to the assessment to approximately 2.4 cleanings per year after being assessed. The green line is the first time that the risk assessment was performed on all patients. But what's really exciting is that those at the high risk, the orange bars, shifted from just cleanings under 1 per year on average to 3.31 times per year. So this tells us that it is driving the right behavior within the high-risk patients, or those who need the care the most. But here's what is really exciting and unique to our new benefit program. To explain, we need to take a moment to talk about the connection between oral health and overall health, and medical conditions, of course. This is the short story. Oral health is health. Research is proving connections between oral and overall health, especially for common chronic medical conditions. And that's why it has our attention at Delta Dental of South Dakota. If oral health is connected to chronic disease, what happens when you engage patients to take care of their oral health? Their overall health improves, reducing medical costs. Let's look at a study from the Weekly Consulting Group who was commissioned by DDPA. Periodontal disease is common, but often underdiagnosed and undertreated. The CDC indicates that 47% of adults ages 30 and older have periodontal disease. That jumps to 70% in adults over 65 years old. The Weekly Consulting Group conducted a study on a group of patients who had periodontal disease, as well as one of the 5 listed medical conditions. The study took a section of these patients and treated them with the necessary periodontal treatments for 3 years. Those who had periodontal treatments lowered the cost of medical services by the according percent based on their condition. For example, a diabetes patient with periodontal disease who was treated with the necessary treatments for periodontal disease lowered their medical costs by 13%. Therefore, by taking care of their dental needs, it not only improved their oral health, but also reduced the cost of their medical expenses. Want to know the biggest number? Avalere Health did an analysis to estimate cost savings to Medicare of a new periodontal treatment benefit for those with diabetes, heart disease, and stroke. They found that providing a periodontal disease treatment benefit would produce a savings of $63.5 billion over the period of 2016 to 2025. Understanding the link between risk assessment influencing behavior, improving oral health, and overall health, and the possibility for reducing the cost of both has led us here. Go ahead and check out the many conditions linked from oral health to overall health. After all the research and studies that we just went over, how is Delta Dental of South Dakota helping improve the oral health of their members? We have launched our new Health Through Oral Wellness program powered by PreViser. What is the PreViser risk assessment tool? It is a questionnaire filled out during the appointment that assesses the risk of caries, periodontal disease, and oral cancer and provides the scores immediately. Chairside. It generates validated risk and severity scores for periodontal disease using a patented clinically based predictive analytics. The scores also include clinically validated restorative needs score, a Canberra consistent caries risk score, oral cancer risk score, and if the risk score is high enough, the risk assessment will unlock additional preventative benefits for the Delta Dental of South Dakota patients with the Health Through Oral Wellness program. What are the scores that unlock additional benefits, and what specifically are those additional benefits? The first score that a patient is evaluated for is the tooth decay risk score. The score is on a scale of 0 to 5. If the patient has a score of 3, 4, or 5, the patient will unlock additional caries benefits. Caries benefits include 4 fluoride treatments in a benefit year, sealants once every 3 years on primary and permanent teeth, and 1 oral hygiene instruction per lifetime. The next score that can unlock additional benefits for a patient is the gum disease risk score. This score is on a scale of 0 to 5, and if the patient has a 3, 4, or 5, the patient will unlock perio benefits, which I will explain in a moment. The last score that can unlock additional benefits for a patient is the gum disease score. The score is on a scale of 0 to 100. If the patient has a 4 all the way through 100, then the patient will unlock additional periodontal benefits. Periodontal benefits include 4 fluoride treatments per benefit year and 2 additional cleanings per benefit year, so 4 in total. These cleanings can be regular prophies or periodontal maintenance treatments, whatever your dentist is recommending for that specific patient. What's great about these benefits is that they are for all patients of all ages. Now your adults can have sealants and fluoride. How exciting! Just because a patient is unlocking these benefits, this is not a diagnostic tool stating that the patient must have that service. It is at the discretion of the dentist and what he or she thinks is best for that specific patient. If it means a total of 3 prophies and 3 fluoride treatments per benefit year, then that is what the patient should have. Not all patients will need all the benefits. It is up to the dentist to determine what is adequate for the situation at hand. Keep in mind, these benefits may apply to the annual maximum of the individual's policy. They will also follow the individual's policy in terms of coverage percentages and deductibles. Not only are all the previous additional benefits included, but as well as the risk assessment itself. Please refer to our website to find the Summary of Additional Benefits document. This document provides all the additional benefits, including the CDT codes, frequencies, and additional loans. When completing the risk assessment, we always recommend doing the comprehensive assessment. Not only does this evaluate the entire oral health of the patient, but can also give a comprehensive report about the individual's oral health and how it can be improved. When billing for the risk assessment, you can only bill for the comprehensive or caries assessment. The oral cancer and the periodontal assessment, when done separately, do not have a CDT code. Also keep in mind, the first time the risk assessment is done, it will take the longest, approximately 5 minutes. Every time after that, there will be an option to preload the previous values for the patient. That way, the clinician only needs to change what is necessary, and that can be done in under a minute. So which Delta Dental of South Dakota members have this additional benefit? all of our fully insured group plans, individual plans, and family plans do. These groups are all automatic to health through oral wellness unless they opt out, and very few have. These groups all have health through oral wellness included in their policy at the start of their new benefit year. For example, if a policy runs January to December, they will be able to have the risk assessment and unlock additional benefits at the beginning of January. If a policy runs July to June, the patient can still have a risk assessment before July. However, they won't unlock additional benefits, and it cannot be billed until after July when their benefit year renews. The remaining groups we cover include our ASO or self-insured groups. These groups take on the risk of their dental plan, and we at Delta Dental of South Dakota administer their dental benefits. With that being said, we give them the opportunity to opt in or to opt out. The majority of our groups have opted in, considering this is enhancing their policy and potentially saving the group in medical expenses. Keep in mind, none of our groups will see an impact in their rates above the annual adjustment. Back to the benefits. If the patient is having a risk assessment once every benefit year, the patient will never lose the ability to have these additional benefits. The benefits follow the patient. So if a patient unlocks benefits at their general dentist and then is referred to a periodontal office, that office can also perform the additional benefits for the patient. The benefits are unlocked for life as long as the member stays on a Delta Dental of South Dakota plan that has health through oral wellness. For the benefits to remain active, the member needs to have an annual risk assessment. We want to prolong the good oral health of our members and ultimately prevent these diseases from ever occurring if possible. So once they are unlocked, they will have them forever. Keep in mind, all patients can have a risk assessment. However, only patients who have Delta Dental of South Dakota and have health through oral wellness will unlock the additional Delta Dental of South Dakota benefits. There are many other Delta Dental member companies who have a similar program but with varying benefits, so be sure to check with that specific member company to understand what their additional benefits are. Any patient can have a risk assessment no matter what their coverage may be. However, only Delta Dental of South Dakota patients who will currently be reimbursed for the risk assessment through Delta Dental of South Dakota is a commercial patient with health through oral wellness, ages 3 to 100 or up. However, don't forget that if you bill one patient, you must bill all patients the same way, not just those with Delta Dental of South Dakota who have health through oral wellness. Since groups and patients change their plans on a regular basis, it is good to practice to always check eligibility. To determine if a patient's group has health through oral wellness or not, you can check patient eligibility on the Delta Dental of South Dakota patient lookup or via faxback. This will determine if yes, the patient has health through oral wellness or not. Please refer to Module 4 for further instructions on how to access this information. Let's look over the assessment to see the format. Notice when going through the assessment, everything is defaulted for a healthy patient. The more the clinician has to change, the more likely it is that a patient will unlock benefits and ultimately benefit from the report to see how he or she can improve their oral health. Once you get to the end of the assessment and have answered it to its entirety, click the button in the top right corner that says Submit. This will bring you to the patient's individualized report. Notice, this report is preventative focused and written in patient terminology. What that means is that you do not have to have a dental background to understand this report or how to improve your oral health. It's simplified. On to the Check Benefits button. All Delta Dental of South Dakota patients will have this on their report screen. Click this button and you will notice a vast amount of information. As a clinician, I would focus on the red text. The first sentence will indicate if the patient's group participates in health through oral wellness or not. If the patient unlocked additional benefits, the second sentence will categorize the benefits, either periodontal benefits, perio for short, or caries benefits. The Click Here hyperlink will further explain what those individualized benefits are. For example, this patient has unlocked both caries and periodontal benefits. This additional benefits message explains it in detail that caries benefits include 4 fluoride treatments per benefit year, sealants once every 3 years on primary and permanent teeth, and an oral hygiene instruction, 1 per lifetime. The perio benefits include a total of 4 cleanings and 4 fluoride treatments per benefit year. Some clinicians have mentioned that they like to copy and paste this message into their clinical notes in their individual software, for example, Dentrix or Eaglesoft. Keep in mind, this message does disappear after 1 business day, but can always be rechecked on the Delta Dental of South Dakota patient lookup or faxback. The value added from health through oral wellness makes Delta Dental of South Dakota a more attractive company for dental benefit purchases for our long-term health. Delta Dental of South Dakota is dedicated to advancing and promoting better oral health. That's why our Smile Smart program has included additional benefits for chronic medical conditions since 2007. Leading scientific research shows the systemic health connection between mouth and body, especially for common chronic medical conditions. Further connecting the two through dental benefits elevates the importance of oral health to overall health and wellness to the general public. Connecting oral health to overall health increases the value of providing dental benefits, especially to purchasers looking to manage the cost of employee benefit packages, including volatile healthcare costs. This positions Delta Dental of South Dakota as an important partner for our healthy, productive workforce, and that can make us all smile. This is an important program and can be a big adjustment in terms of every individual's routine. Ease into the program at your own speed, but the more assessments you do, the easier it will become. Practice as much as possible and reach out to us at Delta Dental of South Dakota whenever you need assistance. We are here to help.